Good morning, everyone. This is Coffee and Conversation. We presented by the Cal Poly CIE Small Business Development Center. Today, we're going to focus on, we're super stoked to have some of the founders, co-founders of two amazing local startups, AcreCloud and Novocuff. These two startups were the winners of AngelCon 2022. So we have a big event every year where it's a Shark Tank style event. We have 6 startups that present to the business community, to an investor crowd. And we work with an investor group ahead of time for 6 months to train them to invest in startups and to select winning startups in which they want to make an investment. So you guys are winners, but it was an equity investment with a real potential for a real ROI, return on their investment for the investors who participate in AngelCon. So we're going to go through this twofold. We have a few slides to present up front, but then I'll have each of our founders talk about where they were at until AngelCon, the AngelCon experience, what impact it had on them, if any. I know it did. And then where they're at now, like what's happened in the last, it's been 6 months. So we'll talk about all those things. So just a few brief slides to start. We're an SBDC, Small Business Development Center. There are about 1,000 SBDCs throughout the US. We're very lucky to have our very own in San Luis Obispo County. And the bottom line is we have a team of 30, 35 plus consultants. They meet with you one-on-one with business owners, and we provide no cost consulting. So it's completely free to the business owner. We work with 600, 700 companies every year, and sometimes year over year. And so we have thousands of clients, but we love helping local business. So there we go. We're funded by the SBA, by the GoBiz office, by the city, by the county. We have lots of support, and we put all that funding to good use helping local businesses. So quick video from our sponsor, Maynard Cooper, and then we'll start our program.
Hi, everyone. My name is Jamal Al-Haj, and I'm a partner with Maynard Cooper & Gale in the firm's San Francisco office. Maynard Cooper is a full-service law firm of national reach with over 300 lawyers across 11 offices coast to coast. Our San Francisco practice focuses on advising emerging growth companies and venture capital firms, including with respect to equity management, financings, employment, and intellectual property matters. We are extremely proud to be a Founders Circle sponsor amongst an extraordinary circle of other dedicated philanthropists who recognize the immense value that Cal Poly's Center for Innovation and Entrepreneurship bring to the SLO community. We hope that each of you enjoys this upcoming training and workshop and are able to incorporate the knowledge and know-how that will be presented shortly to further help grow, develop, and accelerate your businesses.
Thank you, Maynard Cooper. So we do have a Q&A feature in the Zoom webinar setup. So feel free to drop in your questions throughout the presentation. Yeah, so we'll jump right in. We have Jim Kogan, co-founder of AcreCloud, and we have here in person Donald and Amy online, co-founders of Novocuff. So Jim, do you want to start?
Sure.
So just tell us, first of all, what is AcreCloud? What do you do?
Yeah, absolutely. So I'm the Chief Operating Officer of AcreCloud, which is a software as a service company that provides farm management software products to farmers and farm labor contractors. It's an interesting company in that it was actually products. AcreCloud is also the product. So we are still working through some of our naming because we found that it has confused folks a little bit, but AcreCloud is also the main platform that we use, and it's currently being used on 3 million acres of ag land throughout California, Mexico, Texas, and Washington State. It was started as an add-on feature in a bigger company called AcreAgWorks, which provided farm management services to a bunch of different farmers throughout the Central Valley. And as this product started to grow, we realized that this was really where our growth potential was. And software as a service is really kind of cool and sexy and more fun than having to take a spraying team out in the middle of the night to to spray for aphids. So we actually, as a part of AngelCon, which was an incredible experience for us, we pulled AcreCloud out of AcreAgWorks, and actually one of our milestones through AngelCon was to sell off AcreAgWorks to really focus on AcreCloud. So we accomplished that after winning AngelCon, and then we had to go to all of our customers, many of whom were freemium, and we're converting them from freemium customers to pay for service. One of the ongoing challenges for us is that the agrarian calendar is very specific, and technology calendars are very inspecific. And so having to merge those two can be kind of a challenge. Farmers work on their own schedule, which is highly manipulated by the weather and other things that you can't plan. So it has been a fun challenge, but one of the products that we're launching next year, and what we took through AngelCon, is we're calling AcrePay, and it's going to be payroll for farm workers. So farm workers are probably one of the most vital and vulnerable populations in our workforce. And right now in California, there's a lot of wage theft and late payments, and it's not necessarily intentional. There are some bad actors, but it's mainly because everything's done with paper time cards. So we've developed a way where an ag worker can be assigned a card. They can walk onto the farm, run that card, and then get paid through the card. So there's a lot of back-end work with our platform that we've been updating it to make all of that work, and we're partnering with a timekeeping company and a payment company. So we've been working through that process. But AngelCon gave us, obviously the funding is helpful, but just an incredible network of people, and a lot of networking opportunities, and really marketing. Being able to say that you've won AngelCon is a huge step forward. So we benefited a ton from that, and are working to get the company in a place where we launch this product in the first quarter of next year.
So we'll dig in a minute into the details of where you're at and what's going on exactly. I'd like to introduce also Novocuff. So should we start with you, Donald?
We
Or
can have
Amy?
we can have Amy do the pitch.
Okay, Amy, do the pitch, and then we'll and Donald's here as your tech,
Okay.
Yeah.
tech expert.
So Donald and I co-founded Novocuff last year, and we officially became a company at the beginning of this year. And so we are working on a device for, and I'm just going to pre-apologize if I'm a little slurry. I just came from the dentist, so I'm a little numb. And so
we didn't notice anything, so you're good.
Like
you're good.
Coffee or anything yet.
Let me know if you want me to jump in anywhere.
Yeah, well, thanks. So we are working on a device to hopefully help prevent preterm birth, which is a leading cause of infant morbidities and mortalities in the world. And we started on this project. Donald has been working on it for a while, and then he and I teamed up this last August, and then we became officially a company at the beginning of the year. And it was sort of, we've been moving along, figuring out how do we do this? What's the next step? How do we make a pitch deck? And we heard about AngelCon and were recommended we apply. Like, okay, well, let's give it a go. And that completely changed the situation. And we went from not knowing, we're both engineers, so we've watched things from the outside, we've watched pitches, we've watched the business side of things, but it's never been something we've partaken in. And so this was a really big growing experience for us. And we had joined the SBDC, which was great. It offered a lot of resources to us as a company and as individuals to grow and learn from. And then AngelCon had such an expedited growth window of the boot camp, really helped a lot. So I know this is probably jumping forward, Judy, with
Yeah.
that's how we are.
Yeah, and right now I'm just so that people know what it is that you do. So Donald, do you want to jump
Yeah.
in and talk about the device and what it does? And
Yeah. So it's a really simple device, but it's a medical device where if you're diagnosed with something called a short cervix, and so when you go in for your OB checkup, the OBs will check your cervix length, and if it's under a certain length, then you're considered high risk for delivering early. And so we made a device that helps support the mom in keeping basically the fetus inside by adding support to the uterus and also compressing the cervix. And so it's a really simple device that we try to make it minimally invasive. So what solutions do exist, it's for very small window of people. And also it has to be done in an operating room. And so, that already pairs down who a cerclage can be given to. So our device tries to make it accessible to everybody, done in just a regular OB visit versus an OR, and also can be applied to a larger scope of people versus right now what is there. Like if you have twins, with what my wife and I have, twin girls, we weren't eligible for a cerclage because it's considered too high risk. But our device hopefully can then be used for multiple gestation pregnancies. So we just opened up the population of who we can help treat and help prevent early labor.
And Don, can you share, if that's okay with you, your personal story? Because I think that's important. That's kind of that was the impetus for even starting this company.
Yeah, so like I said, we have twin girls, and during a regular visit, basically my wife got her cervix length measured, and it was short cervix. And so it was without any notice. Basically from the visit, we were supposed to get coffee, but that never happened. And she got wheeled straight to Sierra Vista from the OB office. And then, we had twins super early. And in that time, I asked a lot of the OBs and the doctors, both here at Sierra Vista, and our girls got airlifted to Stanford, and the doctors there. And basically there was no real solution out there. And there was nothing that we could have done to prevent this. There's nothing except something called expected management, where you go on bed rest and you have kind of hopes and prayers that we don't deliver early. And so in that time when we were at the NICU, which was almost 6 months, Amy and I both, we have a background in medical device. But yeah, I sat there in the NICU area and I just sketched out concepts, and Cal Poly is learned by doing, and they really drive home good engineers solve problems. And so I thought, this is a huge problem. What's the best way to approach this? So did a lot of research, did a lot of digging into what is out there, what has been tried, and what shows some efficacy, and sketched out something that is manufacturable, something that we think is going to work. And I had this napkin sketch pretty much, and timing worked out where Amy was part of a company called Alidia, some of you may know, and got acquired for a good amount of money, and she had free time then. So I called her for coffee, and I showed her this napkin sketch, and I had this pitch presented to her to ask her to join, and she saw one page of it, and she's like, I'm in. So,
That's great.
So from there, we're like, all right, let's do this. And so that's how we kind of started. And that's how this device was created. We looked around and there was nothing out there.
Yeah.
So Amy, if you can jump back in and talk a little bit, Jim touched on, it was actually a fairly different business concept when we met you and started working with you. Where were you at when you considered applying for AngelCon? Just so people get a sense of the progress that's happened from then till now. So where were you at so this was back in February, I guess, January, February this year.
That feels like years ago.
Yeah, I know.
Where were we at? So we had just officially incorporated, and with Vidya Law helped us, an SBDC client or consultant, and we had officially incorporated, and we were just starting. We had already come up with a few prototypes, ideas, and solid models, and thought, okay, we think this is a good idea. And done our research. We'd spoken with enough physicians that we realized, okay, this is really not only a need, but an actually the idea seems to be grabbing with all the physicians we spoke with. So we were at that point where we just knew we had a good idea and it was worth moving forward. And we were just starting in this realm of, okay, we need to start looking for outside investment because we can't fund this on our own. So that was just, maybe we had, I think we had one investment at the time, and another Lydia / Impress Technologies alumni. And so then that sort of helped move us to a point where we could keep floating and go, okay, what do we do next? And help cover some of the costs of prototyping. But we weren't really, it was really just concept, physician. We had, I think by that point we had maybe 20 to 30 physician interviews that really liked the idea. So we knew we had a good idea medically. And so now we were moving forward with, how do we fund this?
Right.
Yeah.
So, and back to you, Jim. So what you heard us talk a lot about at the start is, so it's great. You got this business model, potential revenue model, you're figuring out your market. But the big one that always comes up, especially when you're very early stage, is traction. So Jim, like how are you able to showcase that traction? I think that's why your story is important about the two entities and how one supported the traction to support the new path you were going on. But do you want to elaborate on that and how you were able to leverage that? And yeah.
Sure. Well, and I think part of that is the credibility that your team has as a founding team. And our CEO is a 6th generation farmer from the Central Valley who also has his master's degree from Berkeley. So he is an expert in farming and has the technology side to really be able to back it up, and developed AcreCloud as a tool for his family's 800-acre pistachio farm, and then started kind of selling it as they created AcreAgWorks. And then as people started to join AcreAgWorks just for the AcreCloud platform, we saw that it was this really exciting, really potentially cool opportunity for not only managing farm labor, because it really started as a work order program, but managing farm labor to collecting data. If you go and look at the USDA website or any other of the very hit or miss sources for ag data in the United States, you see that there's a real need there. And part of our licensing agreement allows us to anonymize and sell data. And we've done that with both of the major political parties and with the federal government, as they've been looking to track ag labor and where it is in the United States and just different movements. I think having big companies like Harris Ranch is one of our big companies, and in the Central Valley, as goes Harris, so goes the Central Valley. Harris is everybody knows the steaks, and everybody has stopped and seen it if they've driven down I-5. But there's in the Central Valley, if Harris is using your technology, then all of the other farmers are like, oh, that's probably good. So from a Silicon Valley standpoint, which is where I spent the first 20 years I lived in California, they are early adopters, and so they've been one of our biggest selling points for getting market traction.
You're a recognized early adopter, and you already had some traction on this platform that that you then spun out, but that helped leverage the software that you're now licensing out to these farmers.
Exactly.
Yeah.
Exactly.
What about you, Amy? What did you see as because you guys, as we talked about, you were super early. What do you think was the compelling part of your pitch to showcase this potential traction, and how were you able to get investor interest at the start?
Yeah, so when I as Donald mentioned, I had worked at Lydia Health also, which started as Impress Technologies in the hothouse at Cal, CIE hothouse. I had worked there, started as an engineer and moved in my engineering role in through a clinical role. So I really helped with a lot of the clinical training of the big trial, the clinical trial that had to happen for FDA approval. And so in that, I got to meet a lot of some of the top maternal fetal medicine physicians in the country and work with these institutions that are known nationally and internationally for maternal fetal medicine and for new technologies and for clinical trials. And so in those relationships that I built, I was able to go back and, you know, I have all their numbers in my cell phone. So I was able to reach back out and say, hey, it's me again. What do you think of this new thing? And, you know, within press, we had a lot of pushback early on because we were very much changing the idea of how to treat hemorrhage. And then this one, we're actually building upon a surgical model that works very well, but is only offered to such a limited amount of people. And so the idea that we would be able to facilitate a broader scope of treatment or treat a broader scope of people with a similar idea of treatment really appealed to a lot of these physicians. And so I think that a very overwhelmingly positive response to our idea and where we were coming from and some of the path that we had laid out and what we were planning on doing was really exciting. And so I think that really helped. I think it really helps investors when they see that and they see, wow, like this isn't just an idea from some engineers. Physicians are now bought on, because at the end of the day, they're our end user, right? Like the patient is the end. They're a user as well, but the physician has to believe in it in order to even offer it to the patient. And so to have such an overwhelming positive response from physicians was a really big deal. And then we had a few that really were interested, and one specifically who's on our advisory board, who really wanted to help spearhead this idea. He's like, this is really important. We have not much to offer our patients, so how do we get this moving forward? So I think that extra motivation, they see our just raw passion for the project and our full buy-in, you know, and our why and why we're doing this. And I think even Donald's story really helps add to that. This is why we're doing it. And I've had, you know, enough experience in maternal health device development that I'm not new to that, this field of physicians. So I think it really helped them come forward and say, we're not only excited, we're totally happy to speak to any of your investors.
Yeah.
So that was a really helpful thing. We've had some early champions in the idea of our device. And so who are willing to speak to people who want to potentially invest.
Yeah. It sounds like it's funny because you actually do have very similar paths in that regard. You have the intense, deep industry expertise on both teams, and that pretty disciplined customer development, you know, and having those early adopters, the renowned early adopters, or people, you know, well-known physicians that are willing to put their name behind this and believe in what you're doing. Yeah, no, it's really cool. So back to you, Jim. So you were at that certain place, you connected with AngelCon, and then we did do some work with you guys. Do you want to talk a bit about your experience around Pitch Prep Bootcamp and what that was all about? And did you hate it? Did you love it? What was your experience?
No, it was amazing. And I think AngelCon is this interesting hybrid. It's a funding competition, but it's really like an accelerator program. And you know, I spent, as I mentioned, I spent 20 years in Silicon Valley. I was last the Affordable Housing and Economic Development Manager for the city of Menlo Park. We had that little social networking startup come into town in 2012 that you know, I got to see grow from a small startup to a great big IPO. And for those of you who don't know where Facebook is, it was Facebook. So just a little company. So seeing that journey, and then, you know, talking with a ton of entrepreneurs, I had a good sense of what the innovation world was like. And then coming down here, when my family and I moved to San Luis Obispo County, meeting Judy a couple of years ago and going through AngelCon, it was at the caliber of you know, the Y Combinators or the hacker dojos of Silicon Valley, but still really focused on entrepreneurs. And so it's an important thread that gets weaved through AngelCon, because instead of having people who are really more focused on building the brand of whatever incubator or accelerator it is, you have people who are really focused on you as an entrepreneur and you as an innovator. And so for us, they were probably too kind about some of our early pitch decks. I look back at, you know, some of the early pitch decks that I put together, and I was like, wow, those are terrible. They were, but you see it in, we have this amazing chief creative officer who is a graphic designer and has been doing it for 25 years. And the first pitch deck that he put together, the advisors looked at and they were like, oh, wow, this is, and I think for them, that was the first time that they were like, oh, this company actually does have something to offer. But, you know, for us, when we got the notice that we were accepted into AngelCon, there was this amazing excitement among the founder team. And then when we made it to be in the top 12 and then the top 6, there was just this continuing momentum of excitement. And you know, anyone who knows Judy knows that she's this just incredible dynamic person who inspires people to really get excited about helping entrepreneurs. And she always gets embarrassed because I'm a big fan of Judy's, and I have joked that when Dos Equis actually has, you know, the most interesting woman in the world, Judy will be one of the people that they bring in. And so anyway, you know, for us going through AngelCon, it was this validation of concept and an unbelievable support that we wouldn't have gotten anywhere else, and definitely wouldn't have been able to come through it. I honestly applied to AngelCon really for those services, you know, expecting to take this ragtag group of co-founders that were spinning out a product, but, you know, really stepping into a totally different world and getting a company out of it. And we got a company out of it with some funding and then ongoing relationships that have really helped us as we're stepping into that next phase.
And well, thank you for all this very how many times do you think you pitched during boot camp and leading up? I'm always trying to calculate like how many times we put you guys through that process.
So it's twice a week. And I think it's funny, it's the speed dating thing of where you have multiple pitches per round. So it's 2 hours, like they're 2-hour sessions twice a week. And I think that's 4 or 6 weeks. Yeah. So
It's about 100 times total.
Right.
Yeah.
And in our case, that didn't feel like it was enough even going into the the prep, but like I said, we had this beautiful pitch deck and a lot of good feedback, because it takes a little bit to explain what we were doing. And, you know, we didn't help ourselves by naming the company and the software product the same thing. So you know, we're still working through some of that marketing a little bit and branding.
What about for you, Don? What was with all the pitch work, what was the biggest change or biggest takeaway? Like, what was the biggest pivot for you guys? You know, when you started the AngelCon process, when you came out of it?
Right. Yeah, I think so. Amy did the heavy lifting of the pitching and, you know, coming and working to really refine kind of a presentation. But the background work was a lot of just organizing everything. And so AngelCon forced us to get everything, you know, in line. So things like our budget and forecast, things we as engineers don't really touch. And so I still remember like a balance sheet. I didn't know what that was. And my wife is, she works in corporate accounting. And so I remember arguing, why can't you just make everything zero and balance? Yeah, but things like that, like things that we didn't understand. Yeah. And so, but those are things that like we had to sit down and learn, and that really helped us figure out, okay, what do we need to raise, and where's the money going, and how are we going to keep ourselves accountable for all this? And so yeah, and along the way, we met with people inside CIE and in the hothouse that really, gave lots of good input. And so I think very early on, it's, making the right decisions and pointing ourselves in the right path is what we believe was going to help us succeed. And I think that has definitely paid itself off tenfold. So,
Thank you.
yeah.
I thought of one other thing. One of the great things about AngelCon is that you do all those pitches and then they bring you back into a group, and it's super intimidating, obviously, when you're stepping out and doing something new. And we were doing it at the tail end of everything being closed through the pandemic, so it's all by Zoom. But they would bring us back into the large group after the pitch sessions, and that's really where you have that mental health check-in of, oh, I'm not the only one who doesn't know what I'm doing, or I'm not the only one who has been confused by this or is looking for clarification. And I think, in that space is where I'm still not exactly sure why she reciprocates it, but Amy and I became buddies, and she became one of my favorite people in AngelCon. And so you do wind up making these connections with other entrepreneurs who are going through the same thing. And I think, just that conversation winds up taking away some of that intimidation. And
It's funny you bring that up because, as most people know, we run an incubator program and we survey our incubating companies. Once they're done, it's a 2-year program. Well, you're both in it, so you guys know. But I think the biggest feedback that we get every single year is the founders talk about the peer-to-peer roundtable sessions that we do once a month, which is we're not programming, we're not teaching, we're not coaching, we're not giving anything very specific or tangible, but it's more getting everyone together. I think it can be a pretty isolating experience being the founder of a startup. It is confusing. You have to believe in it, and you have to be your own believer for a while until you can rally the troops. And so to be able to have that peer-to-peer discussion once a month with other people that are in the exact same boat, I know that's been something that founders really rely on. It's like the one monthly thing where they're okay, I can, there's other people that are going over through the exact same issues and concerns that I'm going with. Yeah. So Amy, you brought up something interesting. You talked about your advisory board, and that's something we talk a lot about with our startups to try to really constantly drive that home and encourage our startups to pull together an advisory board. And I always hear, the biggest pushback that I get, well, we're too early, we don't need it, etc. It sounds like you guys have put together an advisory board fairly early on. Can you talk about how that came about and the benefits you're getting from that and how it's helping you as a company?
Yeah, absolutely. So I think we had early on people we would call upon unofficially, not on a board, but they were sort of unofficial advisors. And I don't know if they knew it. I was just slowly adopting them and they're like, they're my people.
Yeah.
And then I kept having these monthly sessions with Judy, and she was like, how's your advisory board coming along? I was like, I still don't have one. So finally it was like, you need to get a meeting on the book, make an advisory board official. And I think I felt nervous because it's like, well, I don't really know what to talk about. And I'm not sure what, I don't want to take up their time, et cetera, et cetera. And then it really became clear to me that these are people who really believe in what we're doing and believe in us, like Donald and I as humans, and they're experts in the field. And so they have maybe a little more time on their hands, or just a little bit of, they knew that people helped them get to where they are, and they want to be able to pass that on. Like, you always want to be able to pass the baton and pull people up as you rise up. And so I think that there was this moment of going, okay, we're in a weird way, like we're kind of doing each other favors. Like I'm really gaining a lot from this, but also being able to speak back out and say, this is really beneficial and thank you, is I think it's mutually beneficial, but even if it's not, it's really beneficial for Novocuff. And so I think one of the things that was early in those advisory board, we've had one official meeting where we put another on the books, but I think as a CEO, And as a startup in general, you're pitching so often, and even as things aren't going quite as planned, but you're like, we're still pivoting, we're figuring out how to do this, you still have to present in this, like, we have all this together. And it's not that things are failing, but sometimes some days you're like, I don't know what I'm doing today. And I think the advisory board gives you this safe space to be able to say, we don't know what to do in this area, help us. And these are experts who are excited to help us. And so I think that, Donald and I are both engineers, but even if we weren't, and we had a broader business experience woven within the company, there's always going to be things we don't know. And so I think that knowing an advisory board is a group of people who know things that you don't know. That's why you have them, right? So, and being able to say, I don't know this, can you help, is a big thing, in that at least now I do know some of the things, or if I still don't know, I know who to call to help us along with different places. So I would say the advisory board was a little scary at first, because it's almost the opposite of an investor pitch, in that you're supposed to show up to the table with all of the things you're not sure what to do about, which you don't do at an investor pitch. And so in that, it's a shift in mind shift as well, or like how you think about going about those conversations. Mm-hmm. So the meetings have happened and we have that board, but really the biggest benefit is being able to call on them individually as humans and say, hey, we're at this point, like we have one in manufacturing, and say, we're struggling with this little manufacturing detail, can you help us? And he can come help us. Or I'm trying to figure out how to do market projections, can you help me with that? And like that woman can help us. So I think it's been so valuable for us to have one specific people in specific fields to be able to reach out to and get specific information back.
Right. So Jim, do you want to talk about where are you at now? Like what's going on? How has the funding helped? How are you able to apply it? Have you already maybe hit certain milestones? So I think that's some of the work we did, right? We've been trying to change the way startups pitch as far as their use of funds. So how are you going to use this funding, rather than say, oh, we're going to hire a salesperson. We're going to say, no, let's focus on the key results of what's going to happen with this funding, and then figure out, to get to those key results, what are the initiatives you're going to take. Can you tell I've been up to here at OKRs for the last week? But yeah, Jim, what's
sure.
What are some of the updates, and how did the funding help?
So one of our big milestone is launching AcrePay by the first quarter of next year. So that's one of our goals. And backing up from that, we have monthly meetings with Judy, and she's been really helpful at plugging in some of the SBDC mentors and staff who will kind of help us in the areas where we have some lacking. And one of those, we started pitching to other investors and just having casual conversations before pitches to other investors. And they'll tell you, oh, well, send over your pro forma, send over your pitch deck. Let's take a look at what you've got. And in talking with Judy about that after a pitch, she said, and this was her very gentle, kind way of saying, you need more financial assistance. And so not in the form of money, but being able to direct, show where the money's going to go. And we were connected with a gentleman who is in the finance world and does contract CFO work. And we were working through updating our pro forma. And after about a month of working with him to really expand our pro forma to show what we're doing, I said, what about us? What's the potential of us hiring you as our contract CFO? And he said, oh, that would be great. He was really excited about our technology and our company. And so we wound up hiring him to do that. And our pro forma now is so much more impressive. I mean, it's this dynamic document that when we plug in a salesperson, it adjusts everything, including our revenue modeling. And so we're really excited about that. We actually have our final meeting with him are finalizing the pro forma meeting tomorrow. And then he's also helped us to take our strategy for investment in a different direction. And so we're going to be reaching out, which is important right now because, as everyone probably knows, a year ago there was a lot of pent-up appetite for investment, and people were throwing money at you or promising to throw money at you. They never actually throw the money at you, but they were promising to throw money at you. And now with people in hushed tones whispering words like recession, investors are a lot more skittish, and so you need to have more of your ducks in a row, or better lined up. And so we're excited about the work that we're doing with Rolando to get that in place. We have hired some contract engineers to revamp our UI and really prepare it for bringing in AcrePay in a way that is seamless. And we're negotiating on a letter of intent with a workers' compensation insurance company who's very excited to have their clients get on our platform, so then they get better data, which is what again, it all comes back to having really good information, and ours is definitely a big data play as well.
So what are some of the key new contracts that you put in place, or what are some specific milestones that you've accomplished in the last 6 months, where outside of the hires that, okay, we're hitting these milestones that we set for ourselves?
So one of the assumptions that we made going through AngelCon was that at least 75% of our premium service customers would convert to pay for service. And so one of the big things we had to do after AngelCon was have meetings with a large number of them. I mean, we've almost 1,000 customers to get up to 3 million acres, but really and you can't go talk to 1,000 customers in a few months. I mean, that's unreasonable. But we've talked with a lot of the larger customers, and so we're expecting that assumption was accurate. We might actually beat it, but we've had, so that milestone of having gone out and talked to those customers has been met. We added a ranch or a farm in Texas, which is an additional 30,000 acres. So that's a new customer that's coming on, and will be a pay-for-service customer starting at the beginning of the year. One of the interesting things with ag, as I mentioned, there's a calendar, but there's also a calendar for when they actually have money. So for those who don't know and might be interested in ag tech, they don't have any money until after harvest, and then they feel rich until about March. So your window is really November to March, and after March, it's hard to bring in new customers because they've made their budget, they've gotten their annual loan, and they're really not taking on any more expenses until after harvest that year. The other thing that we had to do was test some of our assumptions on our pricing.
So that was my next question.
Yeah.
How do you define pricing? Yeah.
So with AcreCloud, the farm management software, it's a little bit of a lift to go from, hey, we were giving you this thing for free, to now we want you to pay for it. We did have some pay-for-service customers coming in, but that was a small portion of our customer base. And so we charge 25 cents per acre per month. And that, so $3 a year per acre, which is within that kind of sweet spot for farmers, because they don't, if a farmer is over $100 in profit per acre, they're doing pretty well. So you can't be cutting into that too much. And the $3 is definitely within that sweet spot. But we had to test that and talk with a lot of folks, and we feel good with that pricing. With AcrePay, it's actually 2% of their payroll costs, and currently between farmers and farm labor contractors, they're paying about 6%. So, we had to go out to farmers and farm labor contractors and make sure that if we can deliver what we say we can deliver, that reduction for them would be well worth it. And we've had those conversations, and they're excited about it.
That's great. Amy, what about you? What are some of the big milestones that come to mind since well, I guess, May, June till now?
That we've completed, you mean?
Yeah.
Yeah.
Or I mean, or that are in the works, things that are progressing. Yeah.
Great. So I think that we went from some really early rough prototypes to, we have some really nice prototypes that we've been able to put in physicians' hands, and they're like, this is great. Like we've and they fit in the way like better. They're like, oh, this is something that's more familiar, and we could use this, versus, you make something early and it's proof of concept, and to engineers, we think, oh, this is great. We know we can build this. To a physician, they're like, what is this garbage? And so, so we have some really nice, Donald is has expertise in silicone device manufacturing as well. So he's able to, we have a desk there at the hothouse, but it is in his garage. He has a whole, little manufacturing studio set up. We've been able to rapid prototype as we move along. And so I think that's a big milestone, to have something that you can put in a physician's hand and feel pretty proud of and say, this is approximately what it'll feel like. Give us your good feedback on that. But then otherwise, we've hit some good milestones. Some of them have been, and I'm sure I'll forget some of them, but we've been able to test against, if we're saying we're comparing this to the surgical standard of care, we need to know, can we even match those forces that are applied on the cervix? Can we match certain things that we just need to, on the bench, be able to say, yes, we can match them? And Donald's created a really great force sensor that we've been able to put in physicians' hands, and they can do a little surgery on our, fake model, and we can gather those measurements, so we know, oh wow, we can really do this. So we can match these forces, or we are getting clinical trials, like a first in human clinical trial set up. So even the fact that we are already speaking with physicians at a clinical site, and we're starting to work on that protocol, and we've been working with them. These are big milestones, and that once we get that started, that'll be obviously a very big milestone that we're hoping, in the next few months here, getting up and running. But Donald, I feel like I missed a couple milestones that I just can't even think of. But if you think of any, it's just that we move so quickly sometimes. It's kind of fun.
Yeah. No, I think you touched on a lot of the things. There's a lot of parallel paths happening at once. What we did use the money for was, we already had kind of a list of, these are the things we need to be able to make prototypes and iterate quickly. And so as soon as we got funding, that's what we unlocked. And so a good example is anybody who makes like molds or physical medical devices. If you talk to a manufacturer, you get the conversation going and you place a PO, it's still maybe, if you're lucky, maybe 3 to 4 weeks out before you get a tool. We kind of put the things in place in my garage and with the contacts here, where we can probably do that in, a quarter of the time. And so we're able to iterate quicker. And so, yeah, I think that in itself is that's always like, it's not a milestone, but it's something that we're really,
right. Improving your processes. Yeah.
Right. And so, yeah, so we're able to, like Amy said, like, we'll make something, we'll take it to somebody in our advisory board that has a lot of expertise in molding and manufacturing. And, he'll say, change this, or what about this? And I can go back home, change the design. I can either 3D print the mold and actually make it, or I can talk to our machinist, who literally is, 3 blocks away from my house, and we can fabricate something, and then we can bring it back to the garage and build it. And so that's kind of the pace at which we work. And I think that infrastructure setup in itself is a big win for us. And so, yeah, we're not waiting for anybody. We're not, twiddling our thumbs as we wait for manufacturers
to get back to you.
Right.
Yeah.
Right.
Yeah. Well, this is great. I want to kind of open it up to questions from anyone who's here or online. Feel free to jump in. Anyone have a question? Yeah.
You touched on this when I stepped away, but how do you test this device? I mean, on pregnant women, it sounds very.
I'm gonna repeat the question. Great question. So we have a question from our audience. How do you test this device, especially since basically you need a pregnant woman and you need to know that she may be at risk to have a preterm birth? Which, you know, how do you test?
Yeah, great question. Yeah, so medical device, before it makes any contact with the person, you have to do all your testing and kind of due diligence beforehand. And so, yeah, so we look at it as, you know, a device with, you know, failure points as an engineer. And so we go through the list and start testing those things one by one and making sure that it either meets our spec or it surpasses our functional spec. And then the other half of, yeah, you know, how do we know this actually works or, you know, is anatomically comfortable or correct? And so, like Amy said, we actually made a cervix model and it feels like a real cervix. It looks like a cervix. And so we've taken it to Loma Linda University Hospital down in SoCal. And we've had physicians sit there and actually suture it and touch it and play with it and get kind of, hey, what do you think? Does this look like the real thing? Is this, you know, similar to what surgical technique you would use? And we've used that feedback and we've collected that data. We have a force sensor in there. So we collect actual data of how much force they're applying when they're suturing. And those are the numbers and those are the data points that we use. And that's what drives our design or makes us go back and reiterate something. Or the cervix model has a sensor. It's more for force collection. Our device is not going to have a suture or anything that hopefully doesn't cause pain. But what it does do is we can then compare what the surgeons are currently doing in terms of, you know, how hard are they doing it, and we can replicate that with our device, or we can design our device to be equivalent in that nature. And a big help with, you know, being in the incubator program is we have an advisor in the CIE, Chris Howman, who's a professor at Cal Poly, and he gave us a suggestion of Cal Poly has senior projects and master's projects, and you pay a really small fee and you essentially get, you know, a ton of help. You get a year's worth of help with master students. So there's, like you said, there's a lot of testing and concern. And with these students' help, now we can, you know, have 15 different tests that Amy and I were, you know, really scratching our heads, how are we going to get all this done in a timely manner? Yeah, now we parse it out to them and we just give oversight and we, you know, provide a little bit of help and fixtures and things like that, but they would do a lot of the work. And so that's a way, yeah, we keep costs down and get things moving and make sure we test all the high risk items.
When do you know, maybe you want to jump in on this one, that you're ready to do clinical trials? There's some point from that phase into human trials. Yeah,
exactly. So, and this is a tricky field because a lot of other medical devices, there's some sort of good animal model or some good living model that before it reaches a human. And unfortunately, in the field of OBGYN, there's not really a good animal model to simulate that. And so what we do is we do all of this benchtop studies, all of the benchtop studies. We do biocompatibility testing. We make sure the materials are okay. It shouldn't, you know, cause any irritation or sensitivity to the patient. And then we basically exhaust every bench test we could possibly do. And in that, again, so one of our advisors on our advisory board is a maternal fetal medicine physician. We go to them and we ask, like, what is needed for you to feel comfortable to put this in a patient? So I think that's the other thing is we get, like, if there's extra bench studies that they want to really feel like, okay, this is safe, and we have their input on some design features to make sure it should be safe for patients and comfortable for patients. We do that. And then we have a very strict clinical protocol for a small first in human study that has a ton of oversight in it. So again, with this knowledge of, okay, we shouldn't cause any issues, any safety issues. We feel like we've exhausted all of our testing. We still go back in and, sorry, can you guys hear me?
Yeah.
Okay, cool. We still then we go for our first in human trial. It's always this moment where everyone holds their breath a little, but you've done all the testing you could do. And so now you have a very strict protocol, a lot of oversight, a lot of safety tabs built in, and a lot of safety checks for the patient to make sure everything is still working in a way that's at least safe for the patient. And that's our biggest concern in that first study is we're interested if it's, we're interested in efficacy, but our biggest concern is safety. And so we formulate the protocol for a safety study and then also examine efficacy in that. And it's a really small study to make sure everyone's okay. And you do that all with informed consent. Patients understand what they're consenting to, what their other options are. So it is a little nerve-wracking, I think, for everyone. And also it is the path that's the path. So
Thanks, Amy.
yeah.
So we have to end and wrap up, unfortunately, but real quick, Jim, what are you hoping to be your next big accomplishment over the next 3 to 6 months? Like what's the big goal for you, for the company?
Well, I think the two are finalizing that letter of intent so that we can show that we've got this large number of customers that we're going to add on because their insurance company is going to say you have to be on this platform, and then also finalizing the upgraded user interface, and then the last is we had at one point decided that a milestone was going to be bringing together all of the funds that workers are getting from different farms and different farm labor contractors into one check, and that would save them the gas money of driving all around. So we were looking at phasing, so they would get one check and then ultimately have a bank card that they would be able to run. And it looks like through one of our strategic partners that I got connected with through church of all things. So go to church, it can help your innovation career. It looks like we're going to be able to jump that one check milestone and probably be able to offer the card payment method at the very beginning.
That's exciting. That's cool. And what about you, Donald? What do you hope the next 2 to 6 months is going to happen for the company?
I think big thing is definitely we talked about the first in human safety study, and so keeping the momentum going and really getting that set in place before the end of the year. That's our big push, and so everything, all the support work that needs to be done to get there is our big push. So
cool. Thank you.
Thank you.
Thank you so much. Thanks for the updates. So as a reminder, we have our new AngelCon is starting again. So we're looking for new startups to apply. Startups that have applied before, not made it to the top 6 are welcome to reapply. We've had some interesting things happen in that regard. So never give up. We're working with our investors. We had our first investor info session last week, I think it was. But if you know of anyone who'd be interested, it's a $6,000 per unit for investors to put money into the fund. Great experience, incredible network of people. We have close to about already our first 20 or so investors are in, close enough, but we'd love to we raised $205,000 last year. We'd love to raise more this year. It'd be great. So join us or ask us for info, whether you're an investor who wants to, or a potential investor who wants to explore this, or a startup that wants to be considered. And then we have a great workshop with Christy Hale. I've known Christy for, 15 years. She's amazing. She's with one of our local fintech companies, Langorilla, a company that is growing and scaling really fast here in the region. They're doing incredibly well, but she'll be talking about customer service when you are in a company that is scaling. How do you manage that? And as you know, as founders, you're wearing 10 different hats. You're doing your own customer service, and at some point, that's not sustainable. It's not manageable. So how do you put in place the right processes and the strategy to be able to scale and grow fast and still take care of your customers? And she's going to share a lot of really good tips. So join us for any of this. contact us if you want more info. And that's it for today. Thanks so much. Thanks for coming. Good to see you guys.
Thank you.
Thanks, Amy.
Thank you.
Talk to you soon.
Talk to you soon.
Amy.